Okay, good afternoon, everyone. I'm going to call the General Purposes Committee meeting of Monday, June the 19th, 2023 to order. May I have a motion on the minutes? Any errors or omissions? All those in favor, opposed, carried. That brings us to we have a delegation from Dr. Dawar from Vancouver Coastal Health on the subject that you see listed on the agenda. We'll ask you to come forward, ma'am. And we got your revised set of slides on this.
Perfect. Thank you, Mayor Brody. So good afternoon, Mayor and Council. Thank you for inviting me to speak to you today about the unregulated drug crisis. I'll start with a land acknowledgement. I'm pleased and honored today to be here speaking to you on the traditional unceded territories of the Musqueam people, and grateful to be here. I do want to do a couple of introductions. With me is Ms. Karen Barkley, who's the Director of Mental Health and Substance Use Services in Richmond. I understand you may have some questions on services, and she can help me with those. I also have the new Vice President of VCH Richmond Community Services with me, Ms. Joanne Tate. So I wanted to introduce her to you. So on the left in this slide is what I was asked to speak to you about: number of overdose deaths in Richmond, number of overdoses in housing units, and what is meant by the healthcare first approach. I'll speak about all of those, but I'll also speak about the role of housing, because that is what brought this conversation forward. So at one glance, this is the status of the current public health emergency related to the illicit drug toxicity crisis, or the unregulated drug deaths in BC. On the left is the provincial picture, on the right is the Richmond picture, and we can see quite a dramatic picture on the left, with over 2,000 deaths in 2,340 deaths in British Columbia last year, more than 6 a day. In 2016, things changed dramatically, which is when the emergency was declared, and that's because of the incursion of fentanyl in the drug supply in British Columbia. Highly toxic drug, which led to numerous individuals dying prematurely. We can see it worsened in 2017 and 18, and improved in 2019 because of all of the efforts made in terms of treatment and harm reduction services, but unfortunately it took a turn for the worse again during the pandemic. This year we will probably exceed last year's target, and with any luck stay the same. Fortunately, in Richmond, it's not quite as severe, so we are lucky, but I'm sure the 144 individuals who lost their lives since 2016 and their families won't quite feel the same. Richmond deaths account for 1% of deaths in British Columbia. The vast majority are, of course, men in the prime of their lives, 30 to 49 years of age. Nearly a third of the deaths occur in Vancouver, so Vancouver does bear an disproportionate burden. Deaths by geography in Richmond. You may not have seen this information before. Nearly 40% or over 40% of deaths occur in Richmond city centre, but no area of the city has been spared. The vast majority of deaths occur inside in private establishment. There is a lot of stigma. People use alone. A third of the deaths occurred in other indoor settings, and 13% outside. One slide on overdoses in Richmond Hospital. So over 450 overdose presentations to Richmond Hospital per year. 20% are due to alcohol, 9%, so 7 and 2% due to opioid and stimulants. So that's about 3 a month. This is a heat map showing emergency health service calls in Richmond and Vancouver and North Shore. And the purpose of this slide is to again show you the signal that we were seeing in city center from mortality is showing up in emergency calls related to overdoses due to substances. Sorry, one more point about the last slide. You'll see the rates in city center are similar to some other areas in Vancouver, but fortunately not quite what we're seeing in downtown and downtown east side. We get asked about how many people do we think have substance use disorder. Of course, it's hard to know. All we know are the individuals who present to us for services. And so in Richmond, over 1,000 individuals have presented at one time or another to Vancouver Coastal Health, and 3 times as many people have presented due to alcohol use disorder. Decriminalization is a new policy in British Columbia this year, of course. The purpose is to shift the approach to substance use as a health matter rather than a criminal justice issue. It is a chronic medical condition. Decriminalization does not legalize drugs, so drugs are not being legalized. It is not associated with an increase in drug use, as has not been seen and monitored for in other jurisdictions. It does reduce the risk of drug seizures, arrests, criminal charges, and convictions, and other harms. The idea is to reduce the stigma so that people feel comfortable coming to Vancouver Coastal Health or going to see their doctor, even though they may have a small amount of substance on their person. So clearly a lot has been done to build a continuum of care in British Columbia, and a lot more needs to be done. I'm showing you the spectrum or the continuum of care from prevention, harm reduction, treatment and recovery, systems of support, and overdose response priorities. We have much of this in Richmond. I put an asterisk by medication-assisted treatment because just last week the provincial government made an announcement about universal coverage for methadone and Suboxone for all individuals. So that's quite a impressive move forward. I'll pause here for a minute because this is a Richmond Community of Care service map, and I was asked to speak specifically to services. So this is about, again, the continuum of services in Richmond. The boxes circled in green are boxes that existed for some time and likely received some investments during the pandemic. The boxes in yellow are all new and were new investments during the pandemic. So it's hard to see them, but I'll walk through them. So everyone knows about the Anne Vogel Clinic, which truly provides an amazing service to Richmond residents in dealing with substance use disorders. Anne Vogel Clinic will also provide same-day walk-in service to any Richmond resident who's ready to talk about their substance use issues. I'll then bring attention to investments for youth. There have been a number of them. There is a Step Up, Step Down program, which hopefully you can see. I can't. It is a dose. It is a program in partnership with school district where the right amount of care is provided to youth and the dose is titrated. So when youth need more support, they get more support. And when it can come down, the system backs off. But we don't need to bounce youth from program to program. Also, Integrated Child and Youth Program, which provides wraparound care to youth through prevention to treatment. Of course, Foundry has investments in mental health substance use services as well. There's services inpatient, so in people in hospital. There's services outpatient to people in the community. There's outreach services to people who are living in their home, and we will reach them and support them in their home. There's also clinical services for people facing homelessness. So again, we will reach them where they're at. And then the box on the top right, it says peer support and peer engagement. Very important work arising from the Richmond Community Action Team pre-pandemic, which Mayor Brody, you helped start. And that work is to work with peers who inform our services, what they need from us and how, and we use their intelligence in framing our services. I'll skip this slide, but this is a text of all of the new investments and program investments made to the Richmond program during the pandemic. So while most of us were busy with the COVID pandemic, there was a team dedicated to this crisis as well. And it represents several $million in investments. My last two slides about housing. Housing is an important human right, and it's a principle. It's for so that people are better able to move forward with their lives if they're housed. We know that they're better able to receive treatment and manage their illness if they're housed. I know you will be receiving some information on this from city staff. So I'll just move to the next slide, which is about mental health and substance use housing in Richmond. Some of it provided by VC Housing, some of it supported by VCH. All the continuum of care, again, from emergency shelters, supportive housing, to housing operators in Richmond, both doing quality work, market housing, affordable units, and then the licensed independent or licensed units for mental health and substance use individuals who are facing those addictions. And I guess I'll just make one point there. Thank you to the city for your support in making these housing options happen. This is really important to enabling individuals facing mental health substance use issues to move forward in their lives. Of course, we need more. And so in closing, the unregulated drug death crisis is an important public health issue, including for Richmond residents. VCH provides a continuum of services in Richmond. These have received new investments during the pandemic. Service enhancement continues in response to the crisis. Decriminalization is an important policy, an important tool to reduce stigma, to facilitate engagement in care. And local governments, you have an important role in expanding supportive housing options for Richmond residents. And I'll stop here.
Okay, thank you very much, both of you, for coming. We've got a couple of questions. Councillor Au.
Yes.
And I'm going to remind all councillors, we have a long agenda, so really focus. Councillor Au.
So I would like to ask you for more information about the services of NVOGO Clinic. For example, how many people you said, what's the service model? Is it a walk-in? And what kind of services being provided? And somebody said that there's, supervised consumption, drug checking. So, give us a general idea, what's being provided in the NVOGO Clinic.
Sure, I'm happy to do that, and if I don't give you enough detail, Councillor Au is happy to provide more after the meeting. NVOGO Clinic specializes in supporting people with opioid use disorder. It runs on an assessment and full medically supervised treatment model. It is not a safe consumption site. It provides services in assessing someone with their use disorder and prescribing medications such as opioid agonist therapies. You might know them as things like Suboxone or methadone. There's also some new cutting-edge treatments that are available to people, and it's an interprofessional model. So in addition to physicians, we also have social workers, counselors, and outreach workers to help people stay connected to their treatment plan. And we work very closely with community pharmacies to make sure that people can access their medication prescription at a time that's convenient for them. They don't get their medication on site, they get their medication at the community pharmacy just like all of us would for something that's prescribed to us.
Okay, maybe you
How many
could,
people do you serve?
maybe you could send us more information on
Happy
that,
to.
because I'm sure you have a really good summary you could give us in writing.
And then I can give you data about numbers served. At any given time, it's typically over 380 Richmond residents.
Thank you.
Councillor Day.
Thank you very much. And I look at this chart and it looks really promising that there's so much going on. And yet we get letter after letter saying that there's not enough outreach workers, that there's not a recovery center in Richmond, that people have to wait too long to get in, and that housing, well, people phone every number on the list, they still don't get housing. And that if your kids are in school and need to see a counselor, they can wait over a month. So what do you think we should as a council do to improve what we already have started?
Through the chair to Councillor Day, thank you for that question. You're quite right. The system on the continuum of care looks great, but there are a number of gaps still in the system and a number of areas where prevention and treatment programs need to be enhanced. If your question is particularly about youth, I'll ask again my colleague Karen Barclay to comment a bit on the work being done with the school district and so on.
Thank you for the question. With regard to the school district, Richmond's very fortunate to be one of the first 5 communities in BC to be selected to step out with integrated child and youth teams, which is a partnership with the school district. It's not an overnight solution, but it's a step in the right direction to partner with schools to get more school counselor availability for milder and moderate levels of need. And those are very important levels of need to address because those are the things that can exacerbate over time. So we're very committed to prevention and early intervention, and historically that's been a part of the system that's been under-resourced. And so this new partnership with the school district is very important. It's just starting, so I think we're hoping to see more results in the years to come.
What about
Okay.
Recovery Center in Richmond? What, do you think that would make a significant difference?
Could you clarify what you mean by a recovery center?
Like if you finally are ready to ask for help, but you need to go into detox or recovery, is there enough beds for the people who ask for them?
Well, do you want to take that
No,
one?
please.
No, okay. We're always measuring to see what our needs are. There's a certain point where a recovery center, something with an overnight bed, would need a critical mass of people to make it financially viable. And that type of decision-making is made regionally by our regional program through public health. It's always measuring what is the need for each community. And certainly in Richmond, we're really committed to a mobile model that helps people stay at home whenever possible, because home is our priority location, acknowledging that's not always possible for everyone.
Okay, we'll go to Councillor Heed.
Quickly, you'll agree a continuum of care is what is needed to deal with any alcohol or drug abuse substance that we have going on here. So I just have two questions, and specific to Richmond only. I don't care about the regional. I want to know how many detox beds or centers we have in Richmond. And secondly, as a medical health officer for Richmond, your opinion on consumption sites.
Do you want to start with the detox beds?
So detox beds, freestanding detox beds separate and outside of the hospital, we do not have in Richmond. In Richmond, we offer detox within the hospital, so you can have supported detox at the hospital, and we support people to access regional beds, and we support mobile withdrawal management, which is full detox medically supervised at home or wherever you call home. And I'll leave the rest to you. Thanks.
Sure. So through the chair to Councillor Heed about the supervised consumption sites. In Richmond, while we do see that heat map showing a signal in city center, we still don't have enough concentrate. This is not a drive-through service, so people cannot drive to a supervised consumption site and then drive away. People essentially, there has to be enough density of individuals who are using substances who can walk a block or two to that supervised consumption site to access care. We just don't have that density yet in Richmond. Having said that, what we do have need for is episodic overdose prevention service, because there are individuals who may come to us and seeking help with supervised consumption, and they need to be observed to safely using their substances. We're trying to engage people wherever they are in their treatment and recovery journey, which also means keeping them alive so that we can engage them in their conversation about treatment.
One follow-up question really quick. I'm reading through the lines of what you're saying here. People are dying in their homes. People are dying in the public spaces. We know the numbers from Lisa Lapointe each and every month. So what I take away from this, and that's fine, is you're not supportive of it. And those people that want to inject because of their severe drug addiction have to go either through a mobile or somewhere or in their home or whatever. You're not supporting anything, whether it's one stall or not, here in Richmond.
Through the chair and to Councillor Heed, that is not what I'm saying. There's a range of harm reduction services and programs that are already available in Richmond. We absolutely do not want people using alone. There's a lot of peer-witnessed consumption programs, and if people are using alone, there's also a lifeguard app that's available to individuals. Clearly, we want people using with their friends or their families so that someone is keeping an eye on them. I'm pleased to hear that there's interest and support among City council for a supervised consumption site. As you may know, Mayor Brody, about 50% of deaths last year were associated also with inhalation of fentanyl-contaminated substances, not just injectable substances. So what we also need is supervised inhalation sites as well. So I think this is certainly something we have to take back. I know, Karen, you have some thoughts on this as well. Do you want to add?
Just would add through the chair to Councillor Heed that we are, as the health authority, very open to receiving anyone who steps into any of our sites if they have an emergent need or a concern in that moment that they are at risk, that we will help them at that time to be as safe as they possibly can be and to access care. So we do encourage everyone to come forward and let us know if they're in this position so that we can help them in the moment, wherever that may be.
You have to keep in mind that what you're hearing from the councillors are personal opinions, okay? This is not positions of councils. And secondly, the factor that you haven't mentioned, though, except by inference, is its provincial funding would be central to any of this. So I'll go to
Well,
Councillor.
it's just one last comment. It's a little more personal because I was the one who was part of setting up the original insight on this. So it's a little bit more than personal. It's based on experience and research out there. Thank you, Mayor.
I'm not suggesting it's not. I'm just suggesting that it's not a position of council. It's a position of an individual councillor, which is what we want to hear. Councillor Gil Anderson.
Thank you, Your Worship. I just want to clarify the numbers on one of the slides. On number 27 of our handout, the healthcare costs in the province. Because people talk about all the resources that go into bringing people back to life and the huge amount of healthcare costs that are associated with the opioid crisis. But this chart says that the alcohol is like, what, 10 times more than the opioid cost? Is that total cost, or is it just one facet?
I don't have the slide in front of me, so I can't comment on the magnitude, but the objective of that slide is actually to outline that the costs, the healthcare costs from substances is huge, thank you very much, and the healthcare costs of alcohol are quite significant and under-recognized in the public realm. That is quite true.
Okay, and just one more question. It was saying that 84% of people are dying indoors. We just had an update last month in our community safety meeting that in April, 10 deaths were outside and 13 were indoors. So it actually got quite close to 50%. Do you know what that would be attributed to?
Through the chair to Councillor Galanders, I'm actually not aware of that. Of course, we do see fluctuations from month to month. My data was based on about 5 years, so averaged out over 5 years, but you're quite right that trends will change from month to month.
Yeah, I just wonder if it's a trend that's going to be increasing.
We'll keep an eye on that, yeah.
All right, thank you both. Thank you very much for coming. Very interesting presentation. All right, we'll go to the next item on the agenda, the Touchstone Family Association, the Restorative Justice. Who's a staff member on this? Is there anything to add to your report? Is there anything to add to your report?
Staff have nothing to add to the report. I do have Judy Velsonis.
I'm sorry?
Staff has nothing to add to the report.
The recommendation.
So it's moved and seconded. Any discussion on that? I'll only comment, it's about time the province paid for this. They boast about it. It's time that they helped us out on this. But Touchstone does a great job. All those in favor? Any opposed? That's carried. Bylaw Enforcement Officer bylaw. Mark, anything to add to your report?
Moves the recommendation.
To the chair, I have nothing further to add, and I'm open to questions.
Okay, so it's been moved. Is it seconded? Any discussion? Councillor Heed, just a minute.
I want to thank you very much for your work on this. It's taken 7 months, though. That's my criticism with regard to getting to this point, and I told you that earlier, so you know that. But again, thank you very much. It puts it at the same level as all the other bylaw officers in the region, so I want to thank you.
All right, we'll call the question. All those in favor? Any opposed? That is carried. Intermunicipal TNS business license. So that's moved and seconded. Seems extraordinary. You want to add some, and you've got to, everybody's got to go through the process again. So I guess we're going to see this one again in a year or something. Anyway, so it's moved and seconded. Councillor McNulty, you had a comment.
A question or comment, maybe an update. As you know, in community safety for many years, when ride-hailing came in as opposed to taxi services, we were very concerned about safety of the general public, etc. And after coming back from Japan, I read in the paper, we've had other molestation and sexual abuse within ride-hailing services. My question is, the taxi drivers and the what I call legitimate people, we've got some control over, etc. Ride-hailing, we're back to where we were talking about 3 years ago, and worse, actually. So I guess my question is, what controls are we going to have on these ride-hailing services?
Through the chair to Councillor McNulty, requiring for ride-hailing, you need a level 4, class 4 driver's license, which requires a background check. So that would have, I believe the case that you're referring to was an individual with a pre-existing criminal record, but that was an illegal ride-hailing event.
Okay, I guess my question here is, and I would agree with you, I think we're all on the same page, and those of us who were on the previous council are very passionate about this particular issue. I guess I'm wondering, do we have, just because they've got a sticker in the car, you can run those off anywhere you want, we don't know that they're legit. The ones that are what we're looking on mainstream, is there something that we can ask the RCMP to do a check every once in a while with them over? Because I guarantee out there, just because they have a sticker, they're not legit. Many of them don't have a sticker, sorry.
Through the chair to Councillor McNulty, there is a variety of different law enforcement methodologies that the city bylaw department, along with the RCMP, the passenger transportation branch, and transit police utilize. Inclusive of that is proactive law enforcement, where you set up stings. We also rely on complaints from the public as well, but staff can take away the recommendation to explore other methodologies such as verification of license plates and signs.
Unfortunately, the issues that we were dealing with before, we don't ever get the public complaints because they're too embarrassed to bring those kinds of things forward, and I wish they would. And I will support it, obviously, because it's a business venture, Your Worship, but hopefully this will come up with community safety again. We can have a bigger discussion with the chair of community safety and others. Thank you.
Councillor Heed.
And correct me if I'm wrong, Mr. Crowder, the passenger transportation branch does the same level of check on the vulnerable persons check is done through a criminal records check of the individual. These are legal ride-hailing services such as Uber, Lyft, and Caboot. Okay, the one we're dealing with that Councillor McNulty is referring to is an illegal one. And correct me if I'm wrong, we've ran several things. Matter of fact, Richmond has the most frequent illegal ride hauling than most municipalities around the region. Am I correct?
Through the chair to Councillor Heed, I don't have the overall numbers to be able to say if Richmond is leading in this area. There are other potential issues that we have in just proximity to an airport where we're picking up, and we have more pickups and drop-offs than your typical municipality. However, I'm not aware of the overall numbers, whether our enforcement numbers exceed those of a city such as Vancouver.
But you are aware of the enforcement practices because you've told us in the community safety meeting that you have these things and you're successful in them in deterring the activity.
Through the chair to Councillor Heed, we believe we have been successful in putting out a deterrent, and we work very closely with our colleagues in other departments and areas, and we've also advocated for more severe penalties. So we are working with the provincial government exploring sanctions such as suspension of driver's license and the seizure of a vehicle as well.
Thank you.
Councillor Howe.
I just want a clarification. So those licenses are given to companies, not the individual drivers?
Through the chair to Councillor Au, an individual driver must possess a level 4 license, and then there's a license to the business as well, of which there are 5 legally licensed businesses under the IMBL ride-hailing regime.
Thank you.
Okay, I'm going to suggest a referral on this, but let's call the question on the motion. Councillor Day.
Yeah. Have we done anything to educate people about how to get a legal ride-hailing? Because if people just plain don't know, they're going to make the mistake.
Through the chair to Councillor Day, staff have repeatedly advocated with representatives from the provincial government and the PTB about educational awareness campaigns, about signage out at YVR, about educational campaigns within the school as well, and staff will continue to advocate as well.
Okay, let's maybe take the, the lead on it too, like, bus stops and, buses and, let's just make some signs and put them up, maybe get the kids to put them up,
Okay, I'll call the question then on the motion. All those in favor? Any opposed? That is carried. And I'm going to suggest, given the comments that have been made around the table, that we would have a referral to staff to review the experience of licensed and unlicensed ride-hailing services in the city of Richmond and report back. So that's moved and seconded. Discussion on that? All those in favor? Any opposed? That is carried. Brings us to the seasonal patio and extension of service hours. Mark, any comments you want to make on this?
To the chair, I have nothing further to add, and I'm open to questions.
So it's been moved and seconded. Discussion on this one? Councillor Au.
Now, I just want to ask about the hours. So for this application, it's from 9 a.m. to 2 a.m. So why is it not stopped at midnight?
Through the chair to Councillor Au, right now the operating hours for the business are 9 a.m. to 12 to midnight, and the request is for an extension from midnight to 2 a.m. So the current practice right now ends at midnight, and then they're requesting an extension.
But do we know why it has to be extended, or any reason that is to be extended after midnight?
Through the chair to Councillor Au, typically there's some more availability of services, better for business, more income, more profitability.
Okay.
Councillor Hobbs.
Thanks, and through the chair, well, thanks for the report. Just with the assessment that we're going to have you established a baseline for different things, calls for service, medical, fire, nuisance calls, assaults, that kind of thing? So when it comes to the analysis, if it passes and we have a pilot project, that we can conduct a thorough analysis and compare the two periods?
Through the chair to Councillor Hobbs, for this particular report, we typically look at a baseline of events around a food primary or liquor primary, which involves staff looking at business license and bylaw, calls for service, in addition to reaching out to our colleagues within the RCMP to see if this area has been flagged for activity. In this case, none of these issues were flagged in our baseline analysis.
Okay, thank you.
Councillor Day.
Thank you so much. So my only concern is that I believe on Leslie Road, there's residences. And given, if you want to stay open till 2 o'clock inside, that's not really going to affect the residences. But if the patio is too close to those residential addresses, would that not affect them?
Through the chair to Councillor Day, there is a restriction within the permit that it would be closed at 10 p.m.
Okay, so it's 2 a.m. for the inside, not for the outside.
Through the chair to Councillor Day, that's correct.
All right, thank you.
Okay, so I'll call the question then. All those in favor? Any opposed? That's carried. Thank you. We come to the pilot project for the consumption of alcohol in the public parks. Mark and Alex, did you have anything to add to your report?
Good afternoon. I have nothing further to add.
Okay. Councillor Hobbs, you had a question of staff.
Yep,
Go ahead.
thank you, through the chair. In the report, just when I look at the different diagrams for the parks, it seems to essentially encompass all the park. And I'm wondering if thought has been given to having smaller areas in the park for the pilot, because, you know, if you look at Geary Point as an example, and you look at the issue of children, there's children everywhere in that park, flying kites and different things. So would it be sometimes more appropriate to have less of an area than the whole park? And you can kind of apply that question to all the areas. So can you consider that or give an answer to that?
Through the chair to Councillor Hobbs. First and foremost, the parks were located throughout the city for geographical spread, and then located in various neighborhoods for different kinds of context. With the example of, for example, Geary Point Park specifically cited, we were looking at the entire park in terms of it being open and generally used throughout the park for picnics. That said, should it be the pleasure of council, the direction that staff receive to reduce the area, by all means, we could certainly accommodate that request.
Sure, well, I'll hear what other people have to say about that. I mean, when you have a 10-meter kind of buffer zone, that's kind of a hodgepodge of different activities going around. And the one other comment I'll make about the parks is that with Minaroo, for instance, I'm personally, and I'll see what other people think, not in favor of having it on the list. I think we just went to the opening of it. It's spectacular. Congratulations to everybody who worked on it. But to me, it's more of a park of kind of reflection and tranquility. It's got the hospital. It's got a lot of seniors things around it. And the other thing is, when you look at it, it's quite large. There's a lot of trails, visibility, you know, so actually doing enforcement, that kind of thing is a little bit difficult there. I'm just not sure that's a park that would be the same as like King George or Geary Point, but I'll listen to what other people have to say. But my inclination would be not to have that one in the group of five, but thank you.
Councillor Howe.
First of all, I share the same concern that, you know, it seems to be suggested that the whole park would be used for.
Can I suggest questions only?
Okay.
You can make comments later.
So I would like to see, you know, if there's going to be designated areas, it should be better defined. Now, secondly, you know, if people who don't want their kids to see people drinking in the park, and when they encounter those people who drink, who shall leave? The parents of children or the person who's drinking?
Through the chair to Councillor Au, should a pilot project be implemented, and if all parties are abiding by the applicable bylaws and the Liquor Control Acts and Public Parks and School Grounds bylaw, then there should not be a concern. Should an issue arise or a complaint arise that requires bylaw enforcement or public safety, for example, the RCMP to respond, then that decision would be made. You know, the call would go in, and then the appropriate services would be dispatched to address the issue.
Okay.
Through the chair to Councillor Alatiu, I would add also there's provincial legislation regarding drinking ages with minors as well that would come into effect.
Okay. Have we received any requests from the public that we should open up our parks for drinking?
Through the chair to Councillor Au, staff have not received such requests.
Okay.
Okay, go ahead. Finish your questions.
And my question is also about public consultation. So have you asked people in those 5 parks or in the nearby area, what is their opinion or level of support for opening up those parks? So why consultation is not being done before we launch the pilot project as suggested?
Through the chair to Councillor Au, staff were directed to respond to the referral from the report, the meeting, the community safety meeting on May 9th, and the staff responded with the report that is included here. As part of the pilot project, staff would be doing public consultation as part of, should a pilot project go forward. But staff were not directed to do public consultation to prepare this report as presented this afternoon.
My final question is, how do we prevent people from drinking and driving, especially after drinking in the park? And, you know, some parks, as you mentioned, or suggested, like the Kerry Pond Park, I think public transportation is not easily accessible, especially at night. So how do we prevent people driving after drinking in the park?
Through the chair to Councillor Au, the criminal code prohibits drinking and driving up to a certain threshold, and it's pretty low in our province. And the RCMP have the capability of pre-positioning resources to interdict. So those are the different elements of legislation and resources that are available to deal with that problem.
Okay, thank you.
Just before we go to Councillor McNulty and Heed, did I understand you to say that the report identifies a park, and then you would, if this goes through, you would then allow drinking anywhere in that park? Is that what you've said?
Correction. The 5 proposed pilot projects were selected throughout the city.
Right.
In those parks, we are proposing designated alcohol consumption zones where alcohol consumption is permitted. Those are the areas that are indicated on GP 75 through to the end of the report within the red dashed line.
So within the red dashed line is the entire alcohol consumption permitted zone?
That's correct.
Doesn't that mostly incorporate the whole park?
In the case of Gary Point Park, that would be the case. With respect to, for example, Minaroo on page GP 77, we are simply proposing for your consideration, I guess, the northern half of Minaroo Park, and with respect to GP 78 in King George Park, it would be actually a very small section of the western part of King George Canby Community Park, and then in GP 79, that would be also the majority of McLean Park.
Okay, I'll just comment. Well, I think it's most of the park. We'll go to Councillor McNulty.
Yeah, I thank you, Worship. I'm going to focus on that. How did you define these areas? For example, if I look at Minaroo, you've got the hospital right outside. You've got the apartments, the 3 big apartments across the way with all the seniors, and we've got our own proactive living area, and we go right through the children's playground. So I can have a beer while the kids are having a swing. You probably, my question is, it's the same with when I look at Aberdeen, we've got areas, we've got a business area, but to the north, sort of how did you define these specific areas? I guess I got to ask you questions because I wanted to ask you on. So what was the thought to utilize the whole park? And what was your thought of what you just said prior to Councillor Au, when you alluded to we're going to have picnics? Okay, I don't know too many picnics that people go out and have a picnic in the park, especially now when they carry a basket of beer or whatever, and it's not going to be a little brown bag. They're going to carry a cooler or 2 or 3, and we're assuming something that I think is hypothetical. And if family, you pick the biggest family-orientated parks of Richmond used by many, many residents. It's not an isolated park.
Ask a question.
Well, that is my question. Why did we pick these? You know, in our parks, we've cut out smoking. Thank God finally got that. Not around with 100 meters of parks. So how did we pick this? I thought you were going to come back with some isolated areas to it other than to blow it up, to say, hey, come on, gang, on it. Anyhow, you probably can't answer my question right now on that one.
Through the chair to Councillor McNulty. In the preparation of this report, staff looked at precedents throughout the region where pilot projects were initiated. Learning from those examples, we developed a number of site selection criteria that is elaborated upon on page GP 66. And using those site selection criteria, we are proposing 5 pilot sites geographically spread out throughout the city. So east, west, south, north, center of the city in various contexts. And within those parks, we applied the site selection criteria to create buffer zones around, let's say, water parks or active athletic zones, playgrounds, and et cetera, in order to create the zones. These zones are proposed for your consideration, and at your direction, we can certainly alter them should the pilot project proceed.
Well, I guess my question is, I think, given picnicking as one would do it, we'll probably want to go to a table where we could sit down, and if we're going to have family, if I was going to go picnicking. So I thought you might have very restricted it to that area only. I don't want somebody out in the field drinking while I want to play frisbees or whatever with anybody who want to enjoy the park. I guess what we've done is we really, from defining it, and the discussion will come, Your Worship, is we've taken a family-oriented area and taken it away from people to allow people to drink anywhere in the park. And I don't think that was the intent. I've had nobody come and ask me for this.
Okay.
Nobody.
Questions?
So my question is, again, as well, why wouldn't we have consulted before doing anything on this? We're going to get a real blowback on this, I would think. How are we
Let
prepared
him
to answer?
answer the question.
Well, I haven't finished the question.
Well, apparently you have. Why didn't you consult?
That was your thought.
No, that's what you
Could I
asked.
finish?
Why didn't you
No,
consult?
Mr. Mayor, please, okay, let's not, how are we going to handle the blowback from the various people who are going to complain to us?
Through the chair to Councillor McNulty, I would add that there is a 10-meter or 33-foot buffer to the sensitive areas that you have outlined, and that area can be increased. And then typically, regarding complaints from the public, the bylaw department takes those quite seriously, and we would track all of those complaints and report back to council regarding the pilot period.
I have one last question before a discussion. How are we going to assure, possibly, if this goes through, and I think it probably will, but anyhow, how are we going to put signage such that this is a safe park to those that don't drink? We know how to do it for smoking, that this is a clean park. We don't smoke here, and if you want to smoke, it's 100 yards down the road. So how are we going to put signage? Or what are we going to put signage?
Through the chair to Councillor McNulty, as part of the implementation plan, should the pilot project proceed, staff would implement a communications plan through the various city social media portals, the website, which would include maps of the area. Specifically on site, signage would be installed to indicate where those designated zones are and where the public can provide feedback in terms of any bylaw complaints, as well as feedback on the pilot project itself, should that proceed.
Thank you. I'll wait for the discussion.
All right, Councillor Heath.
Thank you. And I think a lot of people are making assumptions that people are gonna carry not only picnic baskets, but, buckets and buckets and buckets of cold beer. That's not gonna happen. It's already happening in our parks right now. I want to tell you, you guys did an absolutely great job. I think your analysis are right on, given the short time frame that you had from the committee. I'm sure, and I'll just make a comment before I get to the question, I'm sure there's some people would like to have a Richmond-Volstead Act incorporated here, so we don't have any alcohol, whether it's driving from a pub, a bar, or whatever. I'm sure that's the case. The question I have to you, and let's keep in mind, parks close at 10 p.m. every night. And this is a short pilot program. It's not etched in stone. So we can amend it if we're going to move beyond the pilot program. My question to you is, I'm making an assumption, talk to all the key stakeholders, including the RCMP, the bylaw enforcement people, the fire service. Is that correct? And if so, what were their comments?
Through the chair to Councillor Heed, staff did discuss and consult with the aforementioned internal departments in the RCMP. In addition, consulted our counterparts in other municipalities who had similar pilot projects, and they did not identify serious areas of concern.
Thank you.
Councillor Day.
Would you consider this a similar pilot to what we did when we allowed the patios out in front of the restaurants during COVID?
Through the chair to Councillor Day, there are elements that can be comparable. I think in the case of the COVID, that was an emergency response to the pandemic, but there were many lessons that were learned that was produced in a very exigent circumstance, so I'm not sure it's a direct parallel.
Yeah, would you say that was a successful pilot program, the patio program?
Through the chair to Councillor Day, I believe it's a program that has been successful in allowing our businesses to offer more services, and it's we've had an uptick in terms of those businesses that wish to continue on a permanent basis.
And I didn't realize that the parks actually closed at 10 p.m. Thank you, Councillor Heed. What other rules would apply to people wanting to have an alcoholic beverage in a park?
Through the chair to Councillor Day, as we mentioned earlier, there's federal legislation in the form of the criminal code, and there's provincial legislation as well that applies, in addition to the city's bylaw with its own regulations.
So basically, you're not allowed to get, drunk in your driveway and, harass your neighbors, but the same rules would apply to the park. I mean, it's about allowing people to, have maybe a birthday party or an anniversary party, because where they live is so tiny. I'm looking at all the park locations, and overall, like Garry Point, I would say very good visibility for law enforcement officers. The same thing with the Aberdeen Park. It's really wide open, so I'm pretty good with that one. And
Is there a question here?
Yeah, I'm working my way. King George Park and McLean are also pretty good visibility, but the Mineral Park is the only one that has a lot of trees. So how would the police officers or peace officers be able to monitor and make sure that, it's a safe environment?
Through the chair to Councillor Day, typically law enforcement likes open spaces with clear lines of visibility under the principles of crime prevention through environmental design, or CPTED. There are a number of different methods, as I mentioned before. Typically, members of the public, when they see a problem, they'll immediately call the police or call the bylaw department. And I would reaffirm that that's the majority of quick response incidents. So I anticipate if there was an issue, they would call either the bylaw department or the RCMP, most likely the RCMP.
Okay, my last question is, this is only until September 30th, correct?
Through the chair to Councillor Day, yes, that's correct.
All right, thank you.
As I understand it, okay, is the bylaw here, or if we approve this, the bylaw would be coming?
Through the chair, to the chair, yes, that is correct. If you were to approve the bylaw, we would approve the pilot program,
Right.
we would bring forward a bylaw.
Okay, and how quickly would that be effective?
It is
depending on the timing, with respect to working with our colleagues in clerks, we would be bringing it forward, I think, at the next council meeting, should the pilot be approved, and the bylaw could receive first, second, and third reading.
Okay, but what about final adoption? When, how much later is final adoption?
Through the chair, to the chair, I would defer that question to our colleagues from clerks.
Okay,
To your worship, it would be at the subsequent council meeting for final adoption. So next week would be the first, second, and third reading if this pilot program was approved, and the subsequent council meeting.
it'd be the first meeting in July. The second one, I just want to clarify, you said that the parks close at 10 o'clock, but in fact, what you contemplate by this pilot project is that the consumption of alcohol would stop at 9 o'clock, right?
To the chair, that is correct.
Okay. All right, thank you, gentlemen. We have a delegation on this, and then we'll get back for discussion, and so don't go far away, because there's going to be more.
Mayor Brody, just a small clarification, the parks close at 11 p.m.
Okay, so it's 11 o'clock, but thank you. That's what I thought, actually. But the consumption of alcohol under this would stop at 9. Okay, we'll go to Dr. Darbar, who wishes to delegate to us on this item. We know who you are. Please move through your presentation. As you know, we've got 5 minutes.
Yeah. Thank you, Mayor Brody. Thank you for the opportunity to present to Mayor and Council about health consideration of alcohol in parks. I'll tell you why I'm here. I'm here because I have responsibilities under the Public Health Act to advise local municipalities about health protection, health promotion initiatives, as well as health hazards. And local governments are required to consult with your medical health officer on these issues. So health impacts of alcohol, there are many. Alcohol, and the evidence has been building in the last decade. Alcohol is a leading cause of preventable death, harms, and disability. It leads to a range of diseases, including at least 7 forms of cancer, heart disease, dementia, GI complications, fetal alcohol spectrum disorder, alcohol use disorder, associated with numerous social problems, including aggression and violent behavior, and of course, impairment of driving related to alcohol use leads to significant injury. Increasing consumption leads to increasing harms. In the pandemic, 2020-21, BC hit an all-time high per capita consumption of 9.32 liters pure alcohol per week. It declined slightly in 2022, which is good. This is the highest in the country, with the exception of the territories. The risk of all-cause mortality and of cancers is dose-related. There is no safe level of alcohol consumption. As was pointed out previously, alcohol is now the costliest substance in BC for taxpayers. Nationally, new alcohol consumption guidelines were released earlier this year, essentially pointing to risk-based consumption, such that increasing use, again, leads to increasing harms. We'll all remember the time not too many years ago when we were advised that 1 drink per day had some health benefits. That's no more. Zero drinks are associated with no risk. 1 to 2 drinks are associated with low risk. And beyond that, we have increasing levels of risk. The annual per capita consumption in BC is about 10 drinks per week. VCH is 9 drinks per week, and Richmond is 5 drinks per week. So I think the task for Richmond residents is to decide, do we want to increase the consumption to bring it closer to the BC average, or decrease it towards the national guidelines of 2 recommended drinks or less per week? You saw that alcohol-related hospitalizations, or rather previous slide, alcohol consumption in Richmond is about half that of VCH, yet hospitalizations are closer to that of VCH. This is an important slide. We've done a lot of work in the last 5 decades on reducing the harms due to tobacco. Tobacco-related hospitalizations are coming down, yet alcohol policy is going in the wrong direction with alcohol-related harms going up. This is a survey from the pandemic. Again, it's the young, 18 to 34 years old individuals who reported increasing consumption significantly during the pandemic, including reporting binge drinking at least 1 or more times a month. And the rate of consumption goes down from there. There is a real risk that public alcohol consumption may lead to, has been shown in some studies to be associated with normalization of alcohol use, particularly for children and youth. Cost attributed to substance use in BC, this is a slightly different figure. Alcohol, this is all societal costs, not just healthcare costs. So alcohol contributes to the lion's share, close to 40% at 38%, followed by opioids at 22%. Healthcare costs, again, significantly high, followed by tobacco, which is fortunately coming down. In the pandemic, things went in the wrong direction. There was a significant increase. British Columbians drank more alcohol during the pandemic than they did ever before. There were a number of provincial policy changes that are likely associated with this and were contributing to this, including wholesale pricing for retailers, home delivery of packaged liquor, home delivery of single-serving mixed drinks, extension to hours of service. While individuals consume alcohol, environmental and social factors have a huge determining role in enabling that consumption or limiting that consumption. We are of the opinion that given the evidence on health risks, alcohol bottles should come with warning labels, probably similar to tobacco. I'll skip this slide in the interest of time. I do want to focus on this because there are different approaches for different public health harms. On one side are completely unregulated substances, and we were talking about opioids a little while ago. Alcohol is on the right side. The best place to be in this graph in terms of health harms is somewhere near the bottom, such that societal and health harms are low, and we want to get the right mix of regulation or regulatory environment. Increasing access to alcohol is pushing the curve to the right for alcohol-related health harms. My recommendation is that the City of Richmond not pursue this policy change. If you do want to go forward, because of course this is my recommendation, and the City Council may make, has a prerogative to make your decision, there are a number of questions you need to ask. What are the possible health, equity, and community impacts of this policy? Who is impacted, particularly youth and vulnerable residents? Who benefits most? And who will stop using the parks because of this policy? Are there ways to monitor? And again, if you choose to go forward, what is the least harmful way to implement? Please consider limiting the number of proposed sites, particularly stay away from sites that have a body of water next to it, set clear consumption limits, prohibit glass containers, and display signage where the public can drink. Thank you.
All right, thank you. We have a question from Councillor Day. And now this is just for questions of the delegation.
Yes.
Then we'll get into discussion.
All right,
Go ahead.
thank you for your report. It's obvious how you feel. Thank you very much for all that information. I was really pleased to hear that Richmond has the lowest rate of 5 drinks per week. That wasn't in your letter that you sent. Maybe you could send the rest of the charts so that we have that information. But I am curious, we just had the seasonal patio for Emperor's Kitchen on the agenda before this, and you didn't come to speak about increasing those hours to 2 a.m. So why are you so much more concerned about a park that closes at, well, last drink is at 9, but you're okay with a bar being open till 2 a.m.?
Through the chair to Councillor Day, thank you very much for that question. That is a very important question. We actually noticed that when the agenda was put in the public realm last week, and I did explore internally with my staff. As I understand, the extension of hours was related to one business and not in general, though I heard something different here. Our assessment, VCH did review that application, but it was from the purview of operating the kitchen for the purposes of safe food delivery rather than the broader use of alcohol. I think if alcohol was coming forward as a policy issue in terms of hours of sale, we would absolutely be here and speaking about that issue.
Okay, and given that this is just until September 30th, do you think that that will be such detrimental effects to the people of Richmond that it's going to cause a huge spike from 5 drinks a week to maybe 6 or 7? Like, what are your thoughts on that?
Through the chair to Councillor Day, the harms from this pilot remain unclear at the moment. I think it needs to be monitored as it is currently being monitored in other municipalities. The issue here is about extension, increase in access broadly, and loosening of the policy environment in municipalities at a rate that we haven't seen before. So you're quite right, for probably 2 months of use, we're not going to see that much, but all of these pilots appear to be getting incorporated as a permanent way of increasing alcohol access in public spaces, and we do have concerns about that. As an option, Mayor Brody, and through the chair again to Councillor Day, you may want to monitor the pilots in other municipalities for a bit longer before the City of Richmond decides to go down this path.
All right, we'll go to Councillor Heath.
Yes, and, I certainly appreciate your position. I appreciate your focus on certain issues as it pertains to Richmond. I've worked with provincial health officers before, and I've worked with regional health officers for sure. I want you to look at slide 15, and you make a statement here: allowing alcohol consumption in public parks may further normalize drinking in public spaces and increase spaces that encourage alcohol use among underage children. Where is the research on that? Is that based on science, or is it based on your own ideology?
Through the chair to Councillor Heath, thank you very much for that question. We thought long and hard before putting that information on the slide. In the notes section of the slide, you will see a reference to that statement. It is coming from publications. We also, related to alcohol, we also see that phenomena quite clearly for tobacco, for example, and that's why a lot of work has been done, particularly in tobacco, to reduce the public consumption of tobacco and other substances.
Yes, but we're not talking about tobacco here. We're talking about a month and a half now only pilot project at the end of the day. Yes, the question is coming. So you make a statement that you don't recommend that we do it, or in your position you don't do it. Do you think a month and a half, like Councillor Day said, is really going to change from 5? We're going to bump everyone up to 10. I know our qualified staff are going to monitor this, and they've done a great job, and they'll continue to do it. Do you think it's going to have a negative impact, or is it going to have something? And the reason why the provincial government changed the rules during COVID to make it more so people could get out in the public and enjoy the public a lot more.
Through the chair to Councillor Heat, I do have concerns about pilots of this nature. Again, the reference that I provided for normalization is in the base of that slide. It does pertain to alcohol. The magnitude of impact from a month-and-a-half pilot are clearly unknown. My recommendation, again, is to monitor other municipalities before we go forward. Our concerns are shared by the Ministry of Health. We are working strongly with the provincial government to address some of the policies that were implemented in place during the pandemic.
Thank you, Mayor.
Okay, Councillor Wolf, then Galanders, then Councillor Au. Time is marching on. I'm going to ask you to just ask one question, and then we go on. Councillor Wolf.
Thanks. My question relates to something you pointed out, where the annual per capita alcohol consumption in Richmond is kind of about half of the average for the province. so about 5 to 10. But then you highlighted, which stood out to me when I was looking at this on the weekend, that the hospitalization rate is so high. Any thoughts on what makes that the case?
Through the chair to Councillor Wolf, that is a very intriguing observation, and thank you for picking up on it. We're actually not quite sure exactly what is responsible for that discrepancy in information. You would think that the health harms would be less in Richmond if the consumption is less. Clearly, the hospitalization data is real because it's coming from an information system. The consumption data is also actually based on sales. So the question is, are the sales in Richmond reflective of the consumption in Richmond? And or are there vulnerable populations in Richmond who are at greater risk of hospitalization and other harms?
Thank you.
Councillor Galanders.
Hey, thank you, Your Worship. Just a quick question. Thank you so much for this. On page 13, the alcohol and tobacco attributable hospitalizations in VCH. So the tobacco use going down steadily and the harms associated with going down steadily. We've done a good job making it not okay to smoke. So there's the stigma attached to it, which shows that stigma in some cases is a really good thing because it makes you want to stop. So do you attribute these decreases in tobacco harms due to the making it unacceptable to smoke anywhere, or how much of that might have to do with the increase in things like vaping being more used now?
Through the chair to Councillor Galanders, I think none of the reduction in tobacco-related health harms are due to the increase in vaping or the substitution of one product for the other, because vaping is relatively new in our landscape. It's only been around for the last decade. Highest uses are in youth, who remain relatively well at the moment. The tobacco-related health harms have been coming down for the last 40 years, very slowly, due to a lot of work through the policy landscape, as well as speaking at provincial government, federal government, and local to reduce use in public spaces, to protect the public from exposure to secondhand smoke, and all of the prevention programs that we've had in place for youth. So a lot of work has been done, and even just this week, I believe there has been some press around warning labels. You'll realize we've had warning labels on packs of tobacco for some time. Now we have them on individual cigarettes. So slightly different examples.
All right, Councillor Au.
Yeah, thank you, Dr. Dawa, for your presentation. Now, you haven't commented on drinking and driving, so I wish that you can comment on that. In particular, you know, if we allow drinking in some remote parks such as Gary Pond, which is not easily accessible by public transportation, do you think there's likelihood of increase of drinking and driving, you know, if we have this pilot project? Especially people after drinking, you know, how do they go home?
Yeah, through the chair to Councillor Au, I'm a bit more uncomfortable with this question because I don't know the data related to drinking and driving and proximity to public spaces and more densely populated versus less densely populated areas. My concern for Gary Point is greater about the proximity to water and the potential for other harms by consuming alcohol in that space.
All right, Dr. Darwar, thank you very much for your comments and giving us your point of view. I suggest someone put some motion on the floor and we'll go from there. Just a minute, I heard so moved. Was council, so moved, what is so moved? The staff recommendation?
Let me go ahead with the.
Is that seconded? Yes. Okay, so it's moved and seconded, and just before we go any farther, I just want to make a comment about procedure here, just to remind everybody as well as the public, because we've run into a problem on this before. There's two things. Whatever we decide today, the final decision is made at the next council meeting. Secondly, we have one councillor missing today But, and Counselor Liu, now that I recall, she mentioned she would still be away next week, but she will be coming in by Zoom. So I expect that we will have a full council next week to make that final decision, whatever it is. So we'll go to Counselor Day. You made the motion. Did you want to comment?
Yes, I do. Thank you very much, Mayor Brody. So we just heard from Dr. Darwa. She had an excellent report, and she's mentioned that Richmond has the lowest alcohol consumption rate of 5 drinks per week, which is great. That's half of other areas. But she also mentioned in her report that that percentage is based on alcohol sales. Richmond is a host to YVR and numerous businesses. We have far more jobs in Richmond than we have adults that live here that can fill those jobs. So we have a lot of people that will come in from Langley or New West or Burnaby, work here, and on the way home could likely stop in to a liquor store and buy something and take it home. So I think that our consumption rate is even lower than the 5 drinks per week. So having a 1 or 2 month pilot project, I think would be a good experiment to see how it would work in Richmond. I also think that Richmondites are actually quite well behaved. And I've been places where I've seen people having a drink, having a beer, and they're not getting drunk. They're having 1 or 2 and they're going home. They're making a hot dog on the grill. You know, I don't think we have to be so strict. And I think pilot project in the case of the patios worked out excellent. We've done lots of other pilot projects in the past. Some have worked, some haven't. We've got nothing to lose. Let's be creative, open-minded, and a little more modern thinking and give this a shot. Thank you.
Councillor Hobbs.
Thank you, through the chair. Yeah, I have a fairly long history in dealing with alcohol-related incidents and public events and that type of thing, and I've seen it work and I've seen it not work so well. Just a quick comment on the park hours. Yeah, you have closing times for parks. Every city pretty much does. It doesn't mean the park closes and shuts down. Parks are pretty active all night long, and that's a matter of an enforcement issue, although the closing time does give people a tool to use if there's a problem happening, so it's an effective tool. I also haven't heard a public demand for this, but then again, that doesn't mean that it's not worthwhile trying if we decide to. The parks identified, and Your Worship, you can direct me, but I would be interested in making a couple amendments to this if it goes ahead, or perhaps we can do that at the next meeting. I'll take your advice on that. I don't mind the parks that are identified in terms of the pilot, except for Minaroo. I'm not in favor of that one being on there. I touched on a couple of reasons why, but long history in Richmond, it's just not the nature of that park. There's a hospital, there's a church, there's, seniors activities like the bowling, and I just don't, and it's also kind of hard to scope out at night if you were dealing with enforcement issues. I just don't see that as being in the same category as the other parks. That's one of the amendments I'd like to offer if we go that way. Regarding the size of the parks, and other people have commented on this too, another amendment that I'd like to have if it goes forward is to have those areas defined a bit more. For instance, if you look at Gary Point, it's a big area, and I don't really see the need to have it in the whole area. I mean, if you go there, we all pretty much know that picnics and that kind of thing happen for the most part in what would be the southeast quadrant of that point. And so somewhere in that kind of corner, I don't know if the whole park is necessary. The west end of it, for instance, is fairly isolated, and you don't see too many people picnicking down there anyway. And the last comment I'll make on it is we do need good data collection and analysis of it to compare if we do this when it's done, including a lot of the points made by the medical health officer. The analysis will be key. It is a short time period, so the data you collect in that, if we do it, will be very limited. So a lot of anecdotal stuff will probably be included too from incidents that happen. So Your Worship, I'll wrap up, but I am interested if you think it's a good idea at this meeting to make a couple amendments and see what happens with those. Other than that, I would support a pilot with the amendments that I make. Thank you.
On the procedure, definitely now is the time to propose amendments. I'm gonna go through the speakers. I'll come back to you on the amendment, and there may be more for that matter. But let's get it as far as we can today, whatever the answer is. So we'll go to Councillor McNulty. Yes, go ahead.
Thank you, Worship. I'm gonna like to make a few points on this. We can rationalize all we want why we should have it, but I don't mind being the only ogre on the city council against alcohol in parks. I think we need to look at what our parks are for and why we built them. And we built them for families and neighborhoods. And I think we're trying to forget that right now. And the particular, what was suggested are being used by everybody in the community. I'm concerned about the perception of safety, as well as if you can't go to a park, why would you go to a park? Are you going to a park to have a beer, or are you going to go to the park to enjoy it? And it's like we're talking, I would defy anybody to go to Mineral Park to go have a beer. You go there for tranquility, the mental health aspect, the relaxation, the passivity. Our parks are passive, and they're sports parks for the most part. And the word is healthy, and that's what they're doing. I have a real problem of, to be quite frank with you, drinking and driving, having worked with counterattack most of my career in the school system, and those kinds of things. And drinking, as soon as you have one glass of beer, one glass of wine, you're actually intoxicated, I think, according to standards. Maybe I'm wrong on that, but you get behind the wheel of a car. Each of those parks one would drive to and are not for the people around that area. Because no one asked for this, and we have not done the consultation, and please, if those of you that are going to support it, put it through. Let's Talk Richmond is very limited in its public support. So you need a further area of public consultation on that, in my opinion. I won't be supporting us. I think I will stand up for those people that want to go to a park, feel safe, have a perception of being safe, and know that nobody is doing this. And voices are getting louder. And if you think persons is going to have one drink or that's going to be it, and it's going to be all picnic, I think you need to give your head a shake on it. And I don't want to compare to other communities because they have issues that Richmond doesn't have. The patio program, I don't think you can serve alcohol outside. I think it changes the liquor license. Correct me if I'm wrong on that. You give me a nod, yes? That's correct. So,
just a minute, I'm not sure that's what he's saying.
Through
can
the
you
chair to
serve
Councillor
liquor out
McNulty.
in the extended portion on the street?
Through the chair to Councillor McNulty, alcohol is permitted outside the patio on the patio if there is a liquor license, either liquor primary or a food primary.
Okay, but not everybody necessarily will have it.
Through the chair to Councillor McNulty, the establishment would need to have a food primary and it would need to have a liquor primary. And in the case of a new seasonal or public patio program, that request would have to go before council, as was the case today.
Yep, thank you for that clarification. So, as I say, everybody can rationalize their point of view. We can't supervise it. If there are issues, etc., by the time it's not going to happen. It's like reporting somebody from about smoking and stuff like that and violating. That's not going to happen. So we only need one incident and we've got a problem. And I think we should be showing we're supporting neighborhoods on it. We should enjoy the parks without alcohol. And I will be voting against the whole issue on it. Until, regardless, because I think there are the majority of people out there don't take the same point of view that this council may take, but it's everybody's prerogative, and I respect your point of view. As long as we can give those other people that are not here a voice and somebody stand up for them. So I think it's there are too many unknowns on this. I think the health officer gave us some very, very good recommendations.
You're out of time, Bill.
Okay, I'm out of time, so Your Worship, I won't be supporting.
Councillor Wolf.
Thanks. I have a bunch of comments here. So for my take, as a younger person and park user in a different way now when I'm bringing my daughter to playgrounds and stuff. To see the border of where drinking will be is basically just outside the playground areas in some of these parks is concerning. The normalization of seeing parents, other people appearing to have fun, and alcohol being kind of the central piece, I think is problematic for our children. I think about students from our high schools that attend the Salmon Fest every year, and I know that park's not included here, but many will go and make it the regular thing to drink in parks. And I think what this pilot does, or perhaps permanent project, would be to open up our park spaces for young people to go and drink and meet up. When they're drinking, they might not have ID, and then the whole complication around trying to prove your age when the bylaw officer, peace officer asks you, are you allowed to be drinking? I just see there's a lot of blurred lines and gray areas that are going to be taken advantage of. I also know a lot of people who, when they're finished drinking, they throw the can as far as they can. They don't take empties with them. And to do this in our parks with the trash problem that I think we have, I think will only be exacerbated by this. I also know people who only smoke when they drink, and I'm sure the blurred judgment would probably have them smoke even though you can't smoke in some of the parks that might have a pilot going on. I do note in the report it says no financial impact, but I think to approve this, and if it were to go to a permanent project, there'd be a major financial impact and also a major priority shift where these peace officers should be doing other important things. Also note something that kind of touched my take on this was I listened to a CBC interview the other day with Senator Patrick Brazeau, who's publicly was an alcoholic and has done great strides to turn his life around. And he's pushed forward a bill, S-254. It just passed the second reading a couple days ago, or a few weeks ago. It's now referred to as Senate Committee on Social Affairs and Science and Technology. And basically what he's calling for is mandatory warning labels, as was mentioned earlier. This is the only known carcinogen in Canada that goes without labels, telling people the health effects of it. I came here today thinking that I wouldn't be able to support any of this, even amendments to it. And I just had this other thought that we have like beer gardens, and we have them coming up at Canada Day Festival. These are often locations where people are kind of fenced in on pavement. I think that's the way to go. If we are going to have drinking in parks, it should be these sanctioned major events, and there should be definitely no access to water, no access for people to pollute or be doing things out of sight, because as soon as someone is drinking, they're going to probably want to have that smoke or do that other thing that they're not supposed to be doing. And I think this is definitely a slippery slope. And yeah, so those are my points for opposing it. Thanks.
We'll go to Councillor Au.
Yes, it's clear that I'm not going to support this motion. And I think one consideration is that we should not have any impact of this policy on people who are not drinking or people who do not want to see drinking in the park. So if we approve these 5 parks, what I'm telling people is that if you want an alcohol-free environment in your park, go elsewhere. So make these 5 parks special for people who want to drink. And we exclude people from the use of these parks if they don't want to see drinking or if they don't feel safe to go to these parks. So that's why I think consultation should be done before we launch this pilot project, not after. We have to ask other users of those neighborhood parks what do they feel about this project before we have it. I've mentioned that I'm concerned about drinking and driving, and I think Dr. Delwa also mentioned that the water, Gary Pond Park being close to the water is another concern. And I also feel that if we have this pilot project and probably, in the future, as a permanent project, we are just creating more work for the RCMP and more law enforcement tasks and costs to the city. So I don't think this is a good idea, and I won't support it, even if we are going to make the designated area more clear. I think still I don't think we should exclude ordinary people who wants the alcohol-free park from use of our space.
Councillor Glanders.
Thank you, Your Worship. I have lots of thoughts on this. I think one of the reasons why we say alcohol in parks isn't a problem. Look, people don't drink very much. When they do, they just have a little beverage. It's probably because it's prohibited, so people are on their best behavior. They do it very subtly. So I can't say that by doing this pilot that people aren't going to start drinking more. I think they might. And I don't think we can say that they won't. To me, the drinking and driving issue is completely not relevant. I mean, I respect my fellow councillors' opinions, but I mean, if drinking and driving was a concern, then we wouldn't have any alcohol in any restaurants or any bars, because people wouldn't be able to go there and have a drink and go. Like, you're supposed to not drink and drive regardless of where you are. So I don't see that as an issue at all as far as my decision making. I do think it normalizes harmful behavior. It's really not okay to drink. More than 0 drinks a week is the only thing that's safe, and we've normalized it a lot in this society. So I'm not really sure what we're trying to accomplish by doing this. I don't know who's asking for it. I don't know who wants it. Like, in my opinion, I feel like the way it is right now is working, because if people do want to have a couple of drinks, the police aren't going around looking for well-behaved people to arrest. So I don't really know what problem we're trying to solve. At the same time, the only thing in this report that compels me to think it's a good idea is the people that they mentioned that don't have any outdoor space, like backyards and whatnot, where they can have people over. So that part makes me think, well, if we are expecting people to live in condos now, then maybe we should have some of it in parks. But that leads me to my thought about beer gardens as well. So, I've traveled to a lot of modern, thriving cities. I was just in Munich in the fall, and every good park has a wonderful beer garden. And it's not even just for alcohol, because in Europe, they have every good beer that you could get, they also have in 0.0 alcohol. You can get Hefeweizen in 0 alcohol, you can get any, so you go into a park, there's live music, you get pretzels, you get your beverage, whether it's alcohol or no, and that supports the economy. And it also sends a better message to children, because it's saying, oh, that's something you do when you're older. That there's a fence, there's a gate, I'm not allowed in there. Whereas when it's just mixed, then children get the impression that, drinking a lot is just okay. I don't drink, so I can't really relate. And I'm not completely opposed to just a pilot, but to be honest, I would rather just not do it right now and do public consultation first, because just with the issue that we are having within the increase in open drug use that's happening in our community, I feel it's kind of hypocritical to say we want open drug use in our parks. Alcohol is a drug, but we don't want people doing other drugs. So, in the parks. So I kind of just think the timing on this is a little bit off. I'd rather make sure that we've really got a handle on where we're going with decriminalization, and have a very, very clear that municipalities cannot allow people to use drugs in parks before we start saying, well, it's okay to use these drugs because they've been normal for so long, even though they're the most harmful drug that we have on the planet. So I don't know. I'm neither here nor there, really, but more not there.
Councillor Heat.
We've been through this before. Publicly, you can go with when we wanted to start with medical marijuana and then go into recreational marijuana. We had the same arguments that all of a sudden it's going to increase the use of marijuana. Well, if you look at the fact that the data doesn't support that, you look at jurisdictions that have had legalized cannabis in place for a period of time, there was no great uptick in people driving while they're impaired by marijuana. It's the same type of behavior. And I do, Councillor Galander said about problems. Our job is not only to fix problems within the municipality, our job is really to increase the livability of this particular community. I was the one that brought this motion forward in community safety, you recall that. And that was all part of trying to move us to the level that other municipalities are within the region. So I take offense when Councillor Chuck Allop talks about ordinary people, thinking that people that consume alcohol are not ordinary people. So I take critical offense to that type of language. But we have to remember, this is a pilot program. This is not something permanent. All of what we're saying that may happen, the experts here, they're going to evaluate that during the pilot. If in fact there is an increase in consumption rates here in Richmond, if there's an increase in juvenile delinquency in our park, remember, underage drinkers are not allowed anywhere. If there is an increase of people littering in the parks, we're going to know this through this month-and-a-half pilot program, and we can either dump it or we can refine it a little bit to make sure we're dealing with the issues. When you look at the stakeholders, when you look at the RCMP, you know, we're second guessing Dave Shohan, the chief here in Richmond, when he comes out and says, you know, he's supporting this. Are we second guessing him? He doesn't know what he's talking about. He's a highly qualified, one of the better chiefs we've had in Richmond. What are we doing? What do we think? We know everything more than the others? You know, and when we get so buried in trying to take a position, I'll tell you, Councillor McNulty may have heard from people that don't want it. I've heard from a ton of people, even across from my town. I was walking through Dover Park right now where they're actually enjoying it over the last few days. And, you know, I asked them, they're sitting there having a beer, what they thought of it. I live right there. I don't see the problems. I've seen shootings in Dover Park, though, gang-related. However, I got to tell you, it's a pilot program. Let's just see if what the doctor is saying that we have to be cautious of, we should be cautious of. Let's just see what happens with the consumption rate. Let's just see what happens with the drinking and driving. Let's see what happens with the police. Thank you.
From my point of view, I'll just mention a couple things because I think this has been a really good debate. I don't go with this idea that it's only a 2 or 3 month pilot project. I think once you start down this road, you've started down the road and you won't go back. But I also think the reason you may not go back, I've consulted with a number of other mayors talking about this particular issue, and they relate that they have had no problems with it, just none. So that's, I think it'll be successful, and that's why we won't be going back. My challenge with this is, though, you've got 5 parks here. I can't support Gary Point Park. I think that's a great place out on the West End for a great party for a bunch of kids and others. I think it's too hard to regulate anything in that particular park. And I think that Minaroo Park is also inappropriate for this. If we, if we can limit it to the other 3 for the pilot project period, then I believe I can support it. But I have real doubts without making that change. So I'm going to go back to Councillor Hobbs. You were talking about making amendments.
Yes, through the chair, thank you. For me, a simple amendment would be 1, to exclude Minaroo Park. And the second amendment would be for staff, when they come back, to reduce the areas in the other parks, and I don't want to get too prescriptive, but right now they kind of encompass the whole park. I know there's things carved out for areas and a 10-meter buffer zone and everything. But the simple amendment there, the second one, would be to reduce the areas to a more reasonable size, and perhaps I'll leave it at that, just reduce the areas. And the example I'd use, and Gary Point might not be on it, but Gary Point to me, if you had it, would be the southeast quadrant. That's where the concession is, it's where most of the picnic tables are, and that's where most of the people have picnics. So, but simply put, to reduce the areas within any park that's part of the pilot.
Would you care to make a third one to confine Gary Point Park to the southeast quadrant?
Sure, okay.
Okay, so the motion is to amend to exclude Mineral Park. Secondly, to generally reduce the areas in the parks to a smaller size and better demarcations. And thirdly, to limit Gary Point Park to the southeast quadrant. Yes?
Sure.
That's it's your motion. I'm not trying to put words in your mouth.
The advice is welcome, and the Gary Point example serves as an example for whatever other park that we may choose to do this in.
So that's moved. Is it seconded? I'll second it. Okay. We don't see any speakers here, so I'm going to go on the amendments. I think we should separate them out.
Okay.
Okay? So, the amendment, first of all, is to exclude Mineru Park. All those in favor? Those opposed? Okay, so that is defeated with Councilors Day, Wolf, Au, McNulty, Heat. Okay, then to reduce the areas in the parks to a smaller size and better demarcated. All those in favor? Those opposed? I didn't see a hand. No, we. In favor. Okay, so you're in favor. All right, so it was Councillor Galanders, the mayor, and Hobbs in favor. The balance are opposed, so it's defeated. The third one is to limit Gary Point Park to the southeast quadrant. All those in favor? Those opposed? Okay, so in favor is Councillor Galanders, the mayor, and Councillor Hobbs. And the balance is opposed, and so that is defeated. So we're back to the main motion without change, and I'm going to call the question on it. Those in favor? Those opposed? It is defeated with Councillors Wolf, Au, the mayor, McNulty, and Hobbs opposed. Okay, so there we are. The last item on the open agenda is the accessibility RCSAC, the work program. May I have a motion?
Move the recommendation.
Moved and seconded. Councillor McNulty?
Yeah, thank you, Your Worship. I appreciate the work of staff. I just want to make council aware, this is a new committee which I'm liaison to, and I think it's very important that council members look at the good work that this committee will bring to us and how we're dealing with this along with our staff in this community. I'm very pleased to be there with them. It's an exciting group, and if you look at the work plan and what have you, we give them great thanks. And, I'm glad we've got a few pennies to operate because they surely deserve it. So kudos to staff and kudos, and thank you to the committee and the members of the committee that are serving on it.
So I said in error, I said RCSAC. It's actually the Richmond Accessibility Advisory Committee 2023 work program.
And I hope staff will pass those comments on at the next
Okay.
meeting.
All those in favor? Any opposed? That is carried. Someone want to move adjournment? Okay, we are now adjourned.